Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about United Healthcare's provider policy changes that will start going into effect September 1st, 2024. Please note that this video is not to educate you on all of the changes and requirements that are going to be implemented by United Healthcare starting September 1st. It is a video to bring awareness to you if it affects you, or to find out if it affects you by doing your own research, your own due diligence, and finding out if, one, it does affect you, and two, being able to implement changes internally at your practice to accommodate those new requirements if needed. August 1st, I believe, is when they announced the changes that are going into effect September 1st. There were also some announced that will be going into effect October 1st, and I believe there was also some that were going into effect November 1st. These policies did affect multiple different specialties. I am going to discuss one that I am for sure knowing about going into effect September 1st. That affects physical therapy, occupational therapy, speech therapy, and chiropractic care. If you provide any of those services at your practice, you would want to make sure that you're looking into this. And also, even if you don't offer these services, I would still subscribe to the UHC provider bulletin if you haven't already, to make sure that you're staying up to date on their changes as they come out every month. And also to make sure that there isn't anything I missed that's going to be changing September 1st that does affect you in your practice. So again, don't take this as everything. Please make sure you do your own diligence. So I do know that September 1st, 2024, United Healthcare in many states now, instead of just the handful that they were already required, are going to make sure that patients who are receiving ongoing physical therapy, occupational therapy, speech therapy, and some chiropractic care are going to require prior authorizations for those services. Per what I read, it doesn't sound like the initial evaluations are going to require a prior authorization, but everything, all the treatment and the treatment plans moving forward after that initial visit is going to require prior authorization. There is some verbiage in there that it looks like maybe they give you a 10-day grace period to obtain that prior authorization of about 10 days after you initiate these services for the patient, but I don't feel that's best practice. Best practice really should be, once you know a patient needs a prior authorization, you get it as soon as possible. Even if you can obtain it before the initial evaluation, that's good, but it is making a little bit more sense that you would wait until the initial evaluation is completed, because then you'll be able to really include and be accurate in your authorization submissions with CPT codes, diagnosis codes, etc. They're probably also going to ask for the length of time that is anticipated to treat the condition and different things like that. So the initial evaluation does make sense to wait to get the authorization until that's completed. If this does affect you, I recommend researching it, finding out exactly the guidelines and the requirements, implementing very quick policies and workflows internally, and making sure that there is a process that as soon as the provider, hopefully within 24 hours of that patient being seen for that initial evaluation, completes their chart note, passes it along to a designated person in the office to obtain that prior authorization, and then someone calling that patient to schedule their ongoing treatments. If you choose to schedule patients for their ongoing treatments before you have that authorization, that is a risk that you're taking, but just know that you would need to have that on file when you're sending claims so that those don't get denied. It looks like United Healthcare is putting Optum Services responsible for reviewing the prior authorization requests and the documentation, but you will, it looks like, provide or apply for the prior authorization through the One Healthcare portal, which is for United Healthcare providers. If you bill United Healthcare, you're very familiar with this portal, but it looks like you'll be able to apply and send medical records and the information through that portal, and then it goes to Optum Services to review and approve or not on behalf of United Healthcare. Again, there's some other little things in there that has to do with multidisciplinary locations and specialties. It also includes Medicare Advantage plans. There are some exclusions to which plans this does not apply to. Again, it's listed in that policy bulletin. I'm going to put the link in the video description for you to reference. Again, do more research than just looking at the link that I'm providing. Sign up for that UHC provider bulletin. I believe there's going to be some upcoming changes in orthopedics and maybe medications in October and November, if memory serves. I've looked up a lot of stuff lately. But again, you should be looking at all the providers that you bill. You should be looking at their updates and be subscribed to their bulletins, their newsletters, however they communicate to providers on a monthly basis, what those changes are, keeping up to date, or have somebody internally at your practice doing that, so that when these are coming down the road, you are being proactive and understanding what's going on. I know September 1st is very, very close. I'm releasing this like less than a week before it goes into effect, but hopefully you're seeing this. Maybe you already know about it. Fingers crossed, you're already being proactive, but this is just a video to bring awareness. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful, and subscribe to my channel if you haven't already. As always, please share this with any of your colleagues whom you feel would benefit and need to know this information as well. I appreciate the support. We'll see you next time. Bye-bye.